What Dan talked about in terms of creating the cliff, that is Medicaid expansion. That is, and you're exactly right. The whole reason why we propose the private option is to put people on a path where they have coverage, that the more they earn, there's no disincentive to work, but the more they earn, the more they pay. And if it didn't do that, I would not support it. That's the whole plan designed to end the welfare cliff, to end all those things. And we've talked about this at great length. And under this plan, that's what happens. In terms of the 100 to 138, the working poor, the cost-sharing benefits are more strict under what we're talking about. And as you move out of that, there is incentives to work. That's the whole point of this. What we're trying to do is push back against, several decades of social welfare policy in this country, which did create exactly what Dan's talking about, a welfare cliff. We have it not only with Medicaid, but we do have it with SNAP, and we do have it with TANF and all these other programs. But under this program, the way we're structuring it, the reason why I'm supporting it is because we're incentivizing the right behavior, and we're not penalizing if you work and earn more. You just pay more for the health care.
I misunderstood what you were asking me to refute there, so I apologize. That's why I didn't.
And if the moderator stopped me, then I'll stop. But Dan, I would ask you to elaborate, because I have no idea how what you were talking about applies to this, because what we have here, under the private option, we will have the most restricted Medicaid population in the country. It will be for the aged, the blind, and the disabled. If you are a working adult, regardless of your FPL, which is your income, no matter where you are on the federal poverty level, as you earn more, you will pay more. So if you get that raise, you'll pay a little bit higher percentage of your cost of your premium, but you will never reach a cliff at which getting a raise pushes you over that cost, where it costs you more, it costs you less to stay where you are. That's the whole point of this system, and you've talked for a long time about exactly the opposite, and I would just ask you to elaborate on where you think the cliff is that traps people into a low-income job, because it doesn't exist.
Dan, take about a minute to respond to that, if you don't mind.
Just very briefly, there's a point that you reach when you no longer qualify for expansion coverage that you pay a very high marginal tax on for your work. And you're going to end up paying that. When I say marginal tax, I mean to buy health care coverage. That's the point at which there's a disincentive to grow beyond that. That's the point at which there's an incentive.
400%?
Yeah, sure.
That's an ACA though. That's an ACA. That's not in this law.
That's not our bill, man.
Right. Okay. But so that is the structure that people in the system are going to face.
How much is 400% of federal poverty, man?
Just to be clear, so we only have one microphone. You want to stand up here? So you're talking about the 400% FP. In ACA, when a consumer reaches 400% of FPL, or anything under 400, they're eligible for a subsidy. At 400, you're no longer eligible for a subsidy. Is that the cliff you're talking about?
Yeah.
Do you want to respond or can you go to the next question?
Let me address it. So I agree with you guys on this particular point, 75%, which is to say that when you go from Medicaid to exchanges, because the benefits are different on the exchanges versus Medicaid, because the cost sharing you fixed, but the benefit wraparound is different on the Medicaid. Yeah. So there's not. So my point is that I don't think there is much of a cliff. I think that if you do get a higher income, you go on the exchanges, it's not that big of a deal. I think that problem is not. That's not the reason to be concerned about the private option. I think the other reasons that I brought up are the reasons that I'm concerned with the private option.
I don't know who wants to tackle this question first, but I'm going to give you